welcome to the channel. Thank you guys so much for staying with me, for subscribing, for commenting. My name is Janice. For those of you who are just stumbling onto this video, I am a healthcare provider. I am a nurse practitioner also. This channel covers everything healthcare. Okay, I have posted some videos that are very important, very informative. So take the time and check this out. So today I wanted to make this video and just cover some topics. And this is gonna be like a series of videos because I cannot put everything into one video today. So I'm gonna put this video out over the next couple of weeks. And these videos are gonna cover my experiences as a nurse, mainly the places that I have worked within the last 13 years. So I have worked in the nursing home, I have worked in the home health settings, I have also worked in the correctional settings, that's the prison settings, and I have done hospitals, bedside, both as a staff nurse and as a travel nurse, which I'm currently doing. So I just want to put that experience out there, let you guys know about those places in case you are looking into working in any of those places and you need information of, how it is working there. So for my first experience, I'm going to talk about the nursing home. That was my very first job within the nursing home. So when I graduated nursing school, I got offered within the nursing home. Of course, it wasn't my first option because I was hoping to start into the hospital settings, but it was the position and I was excited and I accepted the position. So when you work into the nursing home, you work basically as the supervising nurse. That means that you are in charge of the unit, and the units are usually staffed from 40 to 65 patients. Now, within this particular nursing home that I got hired into, our patient to nurse ratio was 65:1, meaning I was the RN that was in charge of 65 patients. Okay, so we also have the LPNs that works on the unit, but their position is to administer medications. They give certain medications, so other medications such as IV medication we have to give, meaning the RNs have to give. So we also have the CNAs on the units who are responsible for patient care, changing the patient, answering the call light, turning, repositioning, showers, and every care or daily living, they assist with that. So as the nurse on the unit, you definitely have to be in charge of the patients. You also have to supervise the LPN because they work with you, and you also have to supervise the CNA. So taking that position as a new nurse is a lot. Now, I was very excited to start off. However, when I started the position, I immediately started to regret my decision because I figured that it was just too much. You do get training, like 3 weeks of training, and that includes learning the system, the EMR system, and also shadowing a nurse on the floor. So it was very stressful for me. So I was immediately not welcoming of that position. However, I said to myself, okay, I need the experience so I can do it. If I have to go back in time, I definitely wouldn't have accepted the position. I was going to wait to get something better. However, it was a huge experience for me. So what I have to give as an advice to new nurses who are thinking about working within the nursing home settings, you definitely got to think about your decision. I would not recommend it as a new nurse because there's a lot of responsibility that comes all at once out of you, and you are just learning how to be a nurse. So, and most of the management are not supportive, so you're definitely gonna have to struggle on your own to get through. And you are definitely putting your license on the line, and that is not good. You work so hard for that. We all know nursing school is not a walk in the park. So it is very stressful to take on position as a new nurse. If I was to be hired within the nursing home settings with my current experiences, I think I would definitely handle it better. However, I have stayed away from the nursing home since my first position. I was in that position for about 4 months and a half, and I left and I went into home care. So that's my experience with the nursing home. If you are thinking about working into the nursing home, for those of you who are working into the nursing home, you know it can be very, very challenging. However, there are a lot of nurses who are still working there. It's a choice. If you decide that's what you want to do, that's fine. But that was my experience, and I would definitely not recommend it for new nurses who are just coming out of nursing school and starting without any experience whatsoever. So if you have your experience with the nursing home and you want to talk about it, leave a comment. Please take the time to like, comment, and subscribe. And when we meet next, I'm going to be talking about my experience within the healthcare settings. Thank you guys so much for tuning in. Thank you for watching. Thank you, and bye for now.